Hey guys, it's Miss Reyes and Miss Ratcliffe, and today we're going to be going over your skill checkoff for IV fluids, primary and secondary.
All right, so I'm going to be reading from your skills sheet, so you should be able to follow along with the video. First, you're going to review your healthcare provider's orders for type, size, bag of IV solution, and rate of infusion. We're always going to verify our patient, provide privacy, check for allergies or contraindications, and we're going to explain what we're doing to our patient. We also need to gather our supplies. So your supplies would include an IV pole, an IV pump if indicated, the correct type and size bag of IV fluid solution. So that's your primary. You also need primary IV tubing. We also need secondary IV tubing and a secondary IV fluid, depending on what that is, whatever's ordered. So once you have all your supplies, we're going to go ahead and enter our patient's room and wash our hands. So when you're giving medications, we're always going to do our 3 checks that you learned during the med administration part and using our 8 rights of medication administration. We're always going to take our IV solution and check for clarity and expiration date, and we're going to squeeze the bag and observe for pinhole leaks. It's a good idea to complete a label including patient's name, room number, date, time, and rate of infusion. We're also going to verify our tubing is correct for either a pump or for gravity. So we're using a gravity tubing. We're going to remove the fluid from the bag and remove the tubing from the package, and we're going to ensure the clamp is closed, excuse me. So while she's unraveling her IV tubing, it's very important that you don't allow your tubing to hit the floor, drag on the ground. It needs to stay pretty clean. You have a cap on the end and you have a cap on your spike. So make sure you're very aware of that. Ms. Reyes is moving her clamp up so she can manage it a little bit better. All right, so now she's gonna go ahead and take the cap off her IV fluids. We're gonna turn it upside down and take the cap off the spike. I'm gonna move in a little bit. We're gonna be very careful here that we're gonna keep those connections sterile. Okay, so when we're touching our spike to our bag, we're not gonna touch on anything else. And then she's gonna flip it right side up. And now we're gonna fill our drip chamber about halfway full. All right, so now it's time to prime the line. You should start out slow. It'll help decrease your bubbles. So you're gonna use your roller clamp and you're just gonna open it slowly so your fluids go through. Miss Reyes is also undid her cap a little bit to where she is able to control that. If you do take the cap off, please ensure your cap is clean and place it back on there so you don't have any contamination issues.
So I've left it on, it's just loose. Also, when you get to the roller clamp, sometimes you have to loosen it a little bit more so that the fluid can come through, and you'll see it starting to come through now.
And I also prefer not to take the cap off. I think it's a safer method. If you look closely down here close to the bottom, you can see the tubing, the fluid going through the tubing. All right, and we're primed. So once our tubing is primed, if your facility has labels for our tubing, you can use that with the date and time started and the time that it needs to be changed, and that'll be per facility policy. All right, so now that we have our primary line ready to go, we're going to assess our IV site for patency. I'm gonna move the camera over a little bit here. So when we're checking for IV patency, we're assessing that IV site for phlebitis or infiltrations, and we're also gonna make sure that it flushes, there's no pain, that our dressing's intact, all those things. So this part is really important that you scrub your hub. When you're scrubbing your hub, you're scrubbing it for a good 10 to 15 seconds, and you need to let it dry. Please remember that all of your saline flushes have a little bubble in them that you need to get out.
So I usually just pull down so it breaks that seal, and then I'm able to bring the saline back up to the tip.
So usually you would check for blood return, and then you would flush, make sure it flushes well and you don't get any blebs or anything like that when you're flushing. So now we're ready to hook up our IV fluids.
If it's been a second since you've cleaned it and all that, you can re-clean the port.
Miss Reyes has the, I'm gonna move over just a second if you can't see it from that angle. She has it kind of hanging off to where the tip of that port is not touching anything, so it is staying clean. Okay, now she's gonna hook that up. I'm gonna move the camera back here. So now we're gonna observe for flow of the IV fluids. Depending on what your rate is, you could either use your jerk factor or put it on a pump. So we're gonna ensure that it is flowing. Stay with the patient for a few minutes during the administration. Monitor the infusion, observe for signs of reaction depending on what it is. We're gonna dispose of all of our supplies and remove gloves and wash hands. But now we have a secondary infusion that we have to get ready. So again, this goes back to our MAR and our orders. So we're gonna use all of those checks, and we're gonna use our medication rights. We're gonna make sure we look in the drug book at the action of the drug, any assessment that's needed, all the things, right? Assess for allergies. So for the IV piggyback, we've already assessed the patency of our line, but you would need to make sure you did that if you were starting that. You want to get the appropriate equipment, which we already talked about, our secondary tubing and our drug that we're giving. If you're going to need an alcohol, so you would also need to bring that with you. So we're going to go ahead and wash our hands and put gloves on again. You would need to explain to your patient what you're doing, what the drug's for. So again, this is the same way we did before. There's two methods for IV piggyback. There's a priming method, number 1, and a backflow method. So we're gonna show you the backflow method because the first method is just like you hooked up your primary. You're gonna hook that up and you're gonna prime it, and then you're gonna put it on the port. So we're gonna do this a little differently. All right, so now that Ms. Reyes has opened up her secondary tubing package, she's gonna clamp her tubing. Always very important that you clamp your tubing, because if you don't, your fluids are going to run all over the floor. So once she has her tubing clamped, she's going to go ahead and open up her secondary bag. And these bags are pretty hard to open. You may have to get some scissors. Just be careful with the scissors and don't cut your bag, your fluid bag. All right, so once we get to this point, she is going to spike her secondary line. And we're not gonna squeeze our chamber with the backflow method. Again, she's maintaining that asepsis and keeping those connections sterile. All right, so once we get to this point, she can go ahead and hang her secondary up, and we're gonna connect the secondary line to the port. And the port on the primary tubing is gonna be the one closest to our bag. You can see it right there, that one. So she is going to scrub her hub for 10 to 15 seconds and let it dry completely, and then connect that secondary. Now remember, at this point, that secondary line is not primed. So once she lowers it below the primary, it's going to finish filling up that chamber, and you want that chamber to be about halfway full. All right, so now we have our secondary line primed, and that is the backflow method. So we're gonna make sure when we start this that if we need to have it on a pump, we have it on a pump. Make sure it's going at the correct rate. Always remember that your highest fluid is gonna go in first. So we have our secondary line hanging up top. So right here, that is gonna go in first, and our primary will take over once our secondary is out. But you always, if most facilities want us to use the pump, so you should be using the pump if one is available for you. So we're gonna clean up all of our stuff, make sure that our patient's comfortable, and make sure you document. Let us know if you have any questions.